Start today's Metro COVID-19 press briefing with Mayor John Cooper, followed by Dr. Alex Jahangir, Chair of the Metro Board of Health and Metro Coronavirus Task Force. We're joined today by Dr. James Hildreth, President and CEO of Meharry Medical College, and Fabian Bedna, Planner for Neighborhood Development and Infrastructure at the Office of the Mayor. Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Dr. Michael Caldwell, Director of Public Health, are here to help answer your questions. We'll begin now with Mayor John Cooper.
Good morning, Nashville. Today's confirmed case count is 67, and that's an improvement over the past several days. Our case count remains slightly elevated, but in consultation with our public health experts, we will continue to examine our public health data with the goal of entering phase 3 on Monday. This decision has been made in the interest of protecting all Nashvillians, our workers and our residents, and to protect our long-standing reputation for safety, which is instrumental to the vitality of our tourism and hospitality industries. We responded early to the pandemic, a new disease with new challenges, and through experience, we are learning what to do and what not to do. And since the roadmap was first announced, your feedback has been vital to help make important updates to improve our phased reopening plan as we learn together. Now, on Monday, we will have been in phase 2 for 28 days. And over the course of those 4 weeks, we have learned valuable lessons to keep Nashvillians safe and inform our decisions moving forward. Once we start on phase 3, the prudent course of action will be to remain in phase 3 for a similar amount of time through 2 complete cycles of potential transmission of the disease, to learn and to make any course corrections necessary to maintain our economic reopening without having to revert to an earlier phase. Through contact tracing, we've learned that proximity, especially in enclosed spaces with limited public health measures in place, can have a profound effect on the spread of the virus, which is why in phase 3, event space venues and small music venues may open, but must cap maximum event capacity, event attendance, to about a half of capacity or 250 attendees, depending on the venue capacity. But people still have to wear masks. Dr. Alex Jahangir will present more details about our COVID-19 metrics and our roadmap plan momentarily. By now, you've all heard about the nationwide spike in coronavirus cases, but here in Nashville, our elevated case count is relatively milder and under better control than many other cities. With your continued vigilance, we will progress with our economic reopening. Please continue practicing safe social distancing. Wear a face covering in public spaces. Frequently wash your hands. And visit one of our community assessment centers to receive a free COVID-19 assessment and diagnostic test. The disease is waiting for us to lose patience. It will reemerge if we do. The virus is not going away. We must make sure our effective social distancing actions don't either. We have the techniques to reopen and be safe if we follow them. Metro Public Health will continue to enforce our public health orders. These enforcement measures include citations that require court appearances and fines, as well as revoked permits and closures. Better days lie ahead, but getting through this will require us to work together. That is the challenge, of course, working together. But on the other side, we will have learned from this and become stronger as a community. Our local tourism industry is essential to our economy, but without a safe, sustained approach, we cannot build the global consumer confidence or maintain the public health capacity required to be a great city. Nashville's hospitality industry is responsible for approximately 71,000 jobs in Nashville, representing more than 1 out of every 10 Nashville residents. And responsible business owners are taking the steps required to protect their staff and their customers. And these business owners are calling for strict enforcement of the rules to protect their reputations, both here at home and around the world. Owning and operating a business has many complexities. Our reopening roadmap provides relatively simple, straightforward rules that help our local business owners protect the lives of their workers and customers, the very backbone of their business operations and their bottom lines. We are asking for compliance, but we will ensure compliance through appropriate enforcement of our public health orders. Once again, the latest uptick in COVID-19 numbers have been caused by newly confirmed cases in neighborhoods from across Davidson County. They are not confined to one community or zip code, but as I mentioned previously, the Metro Public Health Department has also initiated a very focused effort to address a concerning hotspot of confirmed cases in southeast Nashville. This morning, I'd like to welcome Fabian Bednay from our office, who is here to discuss our plan to further address the coronavirus outbreak in Southeast. I also want to welcome Dr. James Hildreth, President and CEO of Meharry Medical College, who is with us this morning to offer his insights as a community leader and a renowned infectious disease expert on COVID-19 and our citywide response to the disease. Now, before I turn it over to Dr. Jahangir, I have some additional news to share with you this morning. I am announcing, and the Chief asked me to announce this, the retirement of Chief Anderson. I am grateful to the Chief for his extra years of service, years after he could have retired. There will be a national search to find a successor, which will not exclude internal candidates. We need to find the best chief for Nashville. Those experienced with these kinds of national searches tell me that at least 6 months can be an appropriate time frame to expect a search to be concluded. As per civil service rules, I will have a committee to assist me with the search process. Nashville will host a major national event in October with the presidential debate at Belmont, and I'm asking the Chief to guide our city through that challenge. I'm grateful to the Chief for providing continuity and a smooth transition. I'm grateful to the Chief's service in this and his service throughout his 45-year career. To serve and protect is the greatest calling. And I'm grateful to the Chief and all our uniformed officers for serving our community. And as always, the COVID-19 Response Fund is available to those seeking direct financial, food, mental health, social service assistance. That's available at the Metro COVID-19 website. And I'll turn it over to Dr. Alex Jahangir, Chair of the Metro Coronavirus Task Force.
Thank you, Mayor Cooper, and good morning, Nashville. Here's the latest on coronavirus in Davidson County. We now have 7,539 confirmed cases. That is 67 new cases in the past 24 hours. There are currently 1,835 active cases in our county. 86 Nashvillians have lost their lives because of COVID-19. Our rolling 14-day average is slightly higher than it was 2 weeks ago. Today's new case is encouraging, but we will continue to watch this average over the next many weeks. Our hospital bed and ICU capacity is satisfactory. There are still around 100 individuals in our hospitals currently with COVID-19. This is an amount which has held stable for the past month, unlike other parts of the state. So this is good news for our community. Our transmission rate is slightly above 1, and this makes it yellow on our dashboard. A rate below 1 shows that the virus is slowing. Now, we continue to improve testing. For a city our size, best practices show that we needed to test around 4,000 people a week. Last week, we doubled that number. And we have sufficient contact tracing resources to investigate the new cases that are coming in. These investigations have showed us a few things about the virus in Nashville. It's showing how it is and how it is not spreading throughout our community. This virus is spreading between families and others, housemates that are living together. It is spreading because people are gathering together in larger and larger groups with friends and family and putting down their guard. It is spreading because when people go out, they are not following the basic precautions we have discussed: wearing masks, social distancing, and washing hands. It is not spreading because people are going to the grocery store or enjoying a walk in the park, or going to work in a safe environment. Now, this information is very helpful to know, especially as we look to go into phase 3, a phase that will begin on Monday, assuming that the data continues to head in the right direction. And we will update the phase protocols based on the data we have gathered over the past month, and we'll continue to amend those based on the data we collect over the next month. Now, as we go into phase 3, we continue to need your help. First, if you have the slightest concern about the virus, get tested. Do you have it? Have you come in contact with someone? Get tested. The 3 community assessment centers are open today, as is our hotline. Second, be smart if you need to go out. Wear a face covering, continue your social distancing, and wash your hands or use hand sanitizer. And third, don't go somewhere that you don't feel safe. You are your own best advocate for your health. If a business does not have safe practices, then go somewhere else. Don't give them your money if they are not caring about protecting you. With businesses opening up, it may feel like we are back to where we were before COVID-19. I want to assure you that we are not. We will be living with COVID-19 for a while. So it does depend to all of us to continue to have a successful phase 3. We'll need you to follow the guidelines, and please don't ruin it for everyone else. I am truly grateful for everything you have done to get us to this point. Let's stay the course, and let's keep focused to continue to have success in the fight against this virus. I now would like to turn over to Dr. James Hildreth. Thank you.
Good morning, Nashville. First, I'd like to share some exciting research published in a top scientific journal recently. A group of investigators from the Scripps Research Institute in San Diego purified B cells from people who recovered from COVID-19 and discovered that some of these B cells made antibodies that totally neutralized the virus in animals and human cells. They purified and sequenced the genes of these antibodies so that they can be cloned, and now they can be produced in large quantities. What's significant about this is that one of the main goals of a vaccine for COVID-19 is to elicit just these kinds of antibodies. So what this means is that these antibodies that they've discovered can be mass-produced and given to individuals who are at high risk, such as people in nursing homes, and achieve the same goal that a vaccine would. I'm excited about this as well because it illustrates the amazing collaboration that is happening by scientists around the world, and also the amazing pace of scientific discovery for COVID-19, which also makes me really encouraged that by this time next year, or a little bit later, we'll probably have a vaccine or multiple vaccines for this virus. This last week has been a challenging week for public health officials and professionals as we watch what is transpiring around the country. Some national leaders have declared victory against COVID-19, which in some ways is to capitulate to the virus because we are nowhere near defeating this virus. And in a lot of ways, such a declaration reflects a poor understanding of the science and biology of how viruses work. Other national leaders have decried the fact that we're doing so much testing because if we didn't do so much testing, we wouldn't have as many cases. Well, actually, just the opposite is true. Because without testing, we cannot do contact tracing, and those two things lead to fewer cases, not more cases. Furthermore, the rise in hospitalizations, which is independent of testing, is the best indication that, in fact, virus cases are rising in many parts of the country. And ignoring the virus by not conducting testing will allow the virus to spread more rapidly, kill more people, and overwhelm the capacity of our healthcare in this country. It might be tempting to assume that we don't have to worry about what is happening in other states and cities. But as been pointed out here before, COVID-19 virus does not respect borders, city borders, state borders, or county borders. And why is that? Because we do not respect those borders, and we are the vector for the virus. So what happens in other places should concern us if we intend to go back to a new normal in which it's safe for all of us to socialize, worship, travel, shop, learn, and work together. we should all be concerned about what happens around us. In a way, the assumption that COVID-19 in other states and cities is not our concern parallels what might be our biggest challenge in fighting the virus. And that is that so many people assume that they will not be infected by or affected by the COVID-19 virus. So they make no efforts to protect themselves and do not respect those who take the virus seriously. There's a paradox here, in a way, because as long as so many of us do not take those steps, the longer it's going to take for us to get back to a new normal. I want to emphasize that there is something that we can all do to hasten the day that this is behind us. And that one thing is for all of us to wear one of these, a face covering of some kind when we're out and about. As has been said before, if we all do it, it won't matter who has the virus. We'll block the chain of transmission, and we'll get back to that day when we can all do the things that we are longing to do. So, if you're not going to wear a mask, I want you to keep in mind the operational definition of what constitutes an exposure. That is, to be in someone's presence, sitting or standing, within 6 feet of that person for 10 minutes or longer. That is the operational definition of an exposure. So if you're not going to wear a mask, please keep that in mind. And obviously, if someone has overt symptoms of a respiratory infection, they should be avoided altogether. Nashville, we got this. Please wear a mask when you're out and not become a vector for COVID-19. With that, I'd like to turn it over to Fabienne Bettner from the Mayor's Office.
Thank you, Dr. Hildreth. I wear a mask every day, so thank you for that advice. So at the end of March, the mayor asked me to start doing a daily Spanish press conference to share information about COVID-19, and I was extremely thankful for that, because doing it allowed me to share information, but also to get feedback from the community. And that information, together with the mayor's office and the Metro Public Health Department, helped develop a culturally competent outreach and support plan to reach out at-risk areas of Nashville, where we continue to see concentrations of COVID-19. The goal is to actively reduce the spread of COVID-19 within communities that had been identified as the hotspots found on the weekly maps. Culturally competent and trusted outreach is extremely important. We have a lot to thank to Latino churches, nonprofits, and Latino media for the work they've done. We will continue to build additional partnerships with community-based and faith organizations to help us reach deeper into the community. Our goal is to connect with trusted leaders within at-risk populations and to build awareness about the virus and the importance and availability of services. The health department will be adding staff and nurses as part of a mobile free testing initiative that can partner with organizations within the community to conduct local testing, and that helps to alleviate potential roadblocks such as transportation, language, and trust. We will not only fund efforts to communicate better with the at-risk community, but will also increase distribution of PPE to residents who request it at home, as many people have roommates as they attempt to quarantine and stay socially distanced. The health department will also be increasing educational and enforcements to business of all kinds, including construction sites. We also plan to increase the safety nets, such as distribution of food in a way that supports people who are required to quarantine, and in doing so, provide safety and security to the extended families and communities and to Nashville in general. We plan to use the CARES Act funding for this effort. This plan focuses on COVID-19 now. My hope is that it continues as a long-term plan for healthier communities for every resident in Nashville. Thank you very much. Buenos días. Muchas gracias.
Thank you, Mr. Bedna. We'll now begin taking questions, starting with Nikhil Smith at WKRN. Nikhil.
Good morning, and thank you for taking my question. The first one is for Mayor Cooper. Given the elevated number of COVID-19 cases in other parts of the country, and you talked about the necessity of helping the hospitality industry in Nashville. Are you encouraging visitors to come to Nashville in phase 3? And then my next question is for Dr. Jahanger. What would prevent us from entering phase 3 over the next few days? Thank you.
Thank you, Nikhil. Mayor Cooper.
Thank you, Mikhail, for that question. Yeah, we're trying to get back to normal. Visitors can come, but visitors need to know we will have our own social distancing rules. And if they go to, in phase 3, a small music venue, we want them to wear a mask. We want them to learn to practice the safe protocols that allow for a reopening and safety. This is the hard thing to do. We're going to have to work together to keep each other safe, to be vigilant and on it. And anybody that comes to Nashville is going to be expected to follow that protocol as we learn to deal with the disease.
Regarding your question of what would prevent us to roll into phase 3, or maybe even a corollary to that is some people will probably ask, do we ever roll back? I think what's going to happen is let's watch the data over the next few days. Is there something what I'm really proud of over the past 3 months, we've developed a really extensive contact tracing team, over 125 people. We have the metrics that show that, over 90% of cases within the first 48 hours, they've done all the investigations and have contacted the individuals who have been in close exposure as was defined by Dr. Hildreth a few minutes ago. So what I hope is as we move forward, we can be more surgically specific on, hey, we're seeing an uptick in this area or this industry, and be able to quickly get in there and prevent the community spread and prevent our worsening. So I guess to answer your question is obviously the data can go up and down. There could be something going on today that we don't know about, right? And we just need to watch it and see if it's something that really has spread out through our community, or something that we're able to contain because now we've built this really strong infrastructure of contact tracing and public health teams that can prevent the community spread. So somewhat of a vague answer, but but it really just depends. So thanks.
Nancy Amons at WSMV, you're on the air.
Hi, thank you. I have questions for the mayor. First of all, on the decision to move to phase 3 tentatively, is this in any way in response to pressure from bar owners that they intend to challenge the city's rules? Also a question, when you're just talking about asking people to wear masks when they go to a venue, are you going to require patrons to wear a mask? Because I don't think they are now. And the final question for the mayor is, with Chief Anderson, did you ask him to retire? Thank you.
Thank you, Nancy, for those questions. And we'll start with Mayor Cooper.
Compliance, we're taking for granted. We're keeping everybody safe in the county. That's our job. Staff and employees, often we get asked by staff members for venues to, they're reporting themselves because they want to be safe where they work. So if there were to be widespread lack of compliance, and by and large everybody is complying, then of course we would and are invoking public health orders to keep each other safe. We have an obligation to each other. We have an obligation to a community standard to be fair and equal in our treatment to everybody in the community. And if somebody is reported, we're going to go and we're going to enforce what is a fair community standard. Now, I believe we require signage having patrons wear masks, and employees are required to wear masks. Our ability to require masks at all times, I'm sure our legal department will look at it. Very interestingly, of course, I think Phoenix and Houston now are getting requirements to wear masks. Now, something that we've been encouraging people for a long time here, other cities have not done. They now understand the importance of doing that. I expect a national expectation to roll out dealing with what we have learned, the effectiveness of masks in the spread of the disease. We have learned that. There was a time, frankly, that masks were, we did not know how important they were. Now we know they're very important. Some things are, as we learn from a new disease with new challenges, let's apply what we know. And some things are not as dangerous. I think Dr. Jahangir hopefully could recite all the areas where we have not had a spread of disease. Well, let's be informed and concentrate. And obviously, let's not leave out our seniors. What we have learned is that it's a super fragile community, and every protection that we can bring into place there is going to be extremely important. So this is not into response into compliance. Frankly, there have been complaints from the same people through every phase. Frankly, it's expected. We're going to weather through that. And as I said in my remarks, I find it challenging and inspiring at the same time. This is a test of how well we work together. It's why other countries thought that it would be hard in the United States, because we in the United States would learn how to work together. Well, okay, let's learn how to work together, and that's going to build our community and our response and all kinds of things going forward. And that's the challenge. Can we work together? Can we get on the same page? Can we be equal in our treatment of our regulations, particularly the regulations that we know are a benefit to everybody in Nashville? And now we are ahead here of what other places have done. Again, look at Houston and Phoenix being so late to the party necessarily, and understanding how to keep their people safe.
Nancy, I believe you had one more question for the mayor. Do you mind repeating your follow-up question?
Can we work together? Can we get on the same page? Particularly the regulations that we...
Nancy, I believe I wrote down your question, and the question was, Mayor, if you had asked Chief Anderson to retire.
Yes, I think it is the right decision for the city at this time. And the chief specifically wanted me to announce it. He's engaged in 45 years of service to the community. And that service requirement, I think his expectation is for the chief executive of the county to make that decision. And we have together. I've enjoyed getting to know the chief. He's kindly lent me books, and most recently, and we have, I feel, a great relationship. But the city, the chief, as I frequently said to the chief, we're going to have a new chief. The question is when, how to do it well. He's had a long career. We need both the best policies and the best personnel going forward. We were always going to need that, and we're going to get that.
Chris Davis, News Channel 5. Chris.
Mayor Cooper, you just said that it was the right decision for Chief Anderson to retire, but we just want to repeat Nancy's question of, did you ask for him to retire? And do you believe the calls for his resignation from some local activists obviously played a role in this?
Thank you, Chris. Mayor Cooper.
Well, no, we're at the end of the fiscal year. And also, to do a search, it becomes a public process. So this is something we've been talking about for some period of time. It's going to be a lengthy process. I want everybody in Nashville to understand just how long these processes take. We're going to need to have community vision for what we need in the public safety space going forward as we get on into the 21st century here. People can be concerned that it's taken us too long, but government works often slowly, but we have a shared goal as a city going forward. People do retire. People at a certain age do retire. People would like to twist that in different directions conceivably, but people are allowed to retire. I actually think that the chief's contribution to the city in the months ahead may be the greatest that he's offered to the city as we have a smooth transition and we enact policies that are deeply committed to by all the elements of the community. And again, people are allowed to retire, and I think it's best for Nashville to understand, with the chief's help, the opportunity that gives us to have a new era, all cities to have a new era in how we do things. My own election last year, I feel, was part of the city embracing a new era. And this is not going to be the only area in metro government that is going to have changes. We've gotten through this difficult budget. The city is now solvent. That's a great accomplishment. It was achieved by compromise and people working together. The next year is going to be the era of management, and that's going to involve all the departments of Metro to make sure that people understand the value that they are being delivered through our services. And again, this is an exciting opportunity to go forward, but that's not a criticism of the past. We just need to be ready to get on to the 21st century in the best possible way.
Ian Jung, it's Tennessean.
Good morning. For Mayor Cooper, would you support the Community Oversight Board playing a role with the search for a new police chief? And how important is it to you to find a Black police chief for Nashville? And I hate to ask you this, but could you please clarify whether you asked Chief Anderson to step down? And my question for Chief Anderson, if he's in the room, is when he had originally planned to retire, if he believes that there's someone within the department currently that's ready to take over, and if he has any regrets about his relationship with the COB and community advocates. Thank you.
So Ian, Chief Anderson is not in the room today, so I will direct your questions for Chief Anderson to the MMPD. Here's Mayor Cooper.
Thank you. As to specifically an African-American chief, no, we want the best chief. We want the best chief. And it'd be super, of course, to have an African-American chief in Nashville, but they need to understand that they're being picked because they're the best chief. And that's how we need to do things. As to the Community Oversight Board, Nashville is engaged in a lengthy learning process of how it is valuable to the community. It is a quasi-judicial body, very important one, that sits on the side to evaluate whether our policies are being enforced correctly, that our policies are being enforced correctly. We need it to look. The words in a policy may say one thing, but are we doing something else? I'm counting on the COB to make us consistent and to catch us on that. It is not a personnel selection body, as I understand it, but we're evolving in our understanding about how to work together and make it useful, to have the community understand that it has another level of check and balance on police practices. So I am excited to, and I was talking to the chairman of the COB yesterday, to have their deep involvement in the review of police policies. But again, you don't want to have the judge needs to say the judge needs to stay where it is. It needs to have its independence and to be excellent at doing what we need it to do, and that is to make sure that we have good policies on the books and that those policies are being enforced appropriately. We want both the right words and the right actions. We don't want the right words, but then they never happened, right? We need that, and that's where the COB is going to be. And in terms of the chief's normal retirement plans, you would have to ask him. I don't know of anybody. I mean, retirement is a difficult decision for everybody, right? And I don't know that anybody necessarily thinks that what the path is. But you'll have to ask the chief what his plan is. But I want the community to celebrate his 10 years as chief. That is twice the length of time on average of all big city, or 3 times the length of time of all big city chiefs. His tenure is a lengthy one. At some point, he, I think, would agree we'll have to retire. This gives us the time to do that correctly, to have the best person possible to be chief, and that's what we're going to do.
Harriet Wallace at Fox 17. Harriet?
Yes, good morning. I've got a few questions. First, I would like to get Mayor Cooper or Fabian to respond to the Supreme Court's decision today that blocks President Trump's plan to end the DACA program. What will that mean for our area, and your thoughts about that decision, that ruling? Now to Chief Anderson. Mayor, I know you're saying that there was discussion about him retiring before, but you know, I mean, this is just interesting timing at this moment when he has decided to retire. What do you believe his retirement will mean, or new leadership will mean, when it comes to race relations in the city, the relationship between the community and police? And then also with regards to his salary and the condition of our finances in the city, will the chief's salary be revisited, possibly reduced? Thank you.
Start with Mayor Cooper.
Well, I mean, as per civil service, the chief's salary is the salary. You know, I mean, and he is the chief until he's replaced. We're going to have a lengthy process, which must be public, to bring the community together to find the right replacement for the chief. The chief's departure does not necessarily cure what we need to get done in terms of community relations and the fulfillment of equal justice under law in Nashville, Tennessee. That's a goal. Few cities really completely live up to it. We want to live up to it here. It's a great moment to rededicate us to doing that. So again, the chief remains the chief. While he's the chief, we need it. It is a hierarchical organization, to be sure. And, you know, because of that reason, people do not discuss retirements or contingencies, et cetera. Police need to understand that he's the chief executive officer of the police while he's the chief, and, you know, he needs to run that department, and we all expect him to run that department. As for today's DACA decision, I'll let Fabian come and address that. You know, it sounds good, but again, frankly, that's at the national level, and he'll have a better insight into that. This is a great week for Nashville. It's a time to honor someone who has served us well. It's a time to realize that for the first time in 24 months, we actually have a legislative budget. We were able to stay solvent in a time of our greatest financial challenge by working together and compromise. Okay, it sounds like government is working to me, and that is a great thing.
Wear a mask. Thank you for asking that question. The Supreme Court is in line with, I think, 78% of Americans that believe that these young people that were brought here by without their have anything to do with it have an opportunity to have a legal status. Now, it's really up to the Congress to come up and decide a compromise on how to address immigration enforcement. In the meantime, many of you probably know a DACA recipient. They are already working, helping us on the healthcare field. Right now, as you go to the doctor to take care of a COVID issue, you'll find some of these young immigrants trying to help you. So I think the Supreme Court did what most Americans wanted them to do, and now I hope that the Congress will do as well. Personally, I'm happy for many of these DACA recipients that I personally know and that they are doing a great job for Nashville. Thank you.
Nayeli Alamia at 96.7 FM.
Thank you so much. First of all, I wanted to thank Fabian Bedne for all the hard work that he has provided to us Spanish media. And I wanted to ask is, I know you guys mentioned that you guys be updating the roadmap for phase 3. When could we see the update in Spanish? As of right now on the COVID-19 website, phase 2 in Spanish says no more than 50 people, not 25, like it currently is in English. When can we see that update as well in Spanish? And when can we see more information on the matrix that you guys have been monitoring also in Spanish? And thank you, Fabian, for your comment on DACA. Thank you.
Thank you, Nayeli. Dr. Jungir.
Thank you for that question. It should be very soon. Hopefully any minute, with an hour. So we'll have it updated. So just stay tuned. Thanks.
Our last question today is from Blake Farmer at WPLN. Blake?
Thank you. Just two brief points. One is, who ultimately made the decision to move on to phase 3? And then is there any one, I mean, obviously the 14-day trend is not headed in the right direction. So what other bit of data sort of kicked it over the edge so you decided that it was time to move on?
Thank you, Blake. Dr. Jahangir?
Blank, thank you for that question. So as you said, the ultimate decision is made by the task force. Obviously, all of us advise the mayor, and you know, the mayor's the chief executive of the city. But I want to be very clear. I was involved in the decision. Dr. Hildreth, Dr. Caldwell, several other public health experts and physicians from around the city and the state, frankly. You know, I think it's really interesting to me because your question is one that I know we've talked about in private and publicly. It's never been one metric. We've always been saying it is a collection of all the metrics, right? So I want to be very clear. Yes, the 14-day trend is heading upwards, okay? But it's heading, it's the past 3 days, frankly, it's actually stabilized and started heading downward. But 14 days is just, I think, 95, 96. 14 days ago, I think it's 120 today, the average. We're looking at a lot of other metrics, okay? So in addition to what you just mentioned. So do I wish transmission rate was a little lower? Absolutely. Am I happy that our hospitalization rate has been stable for over a month? Yes. Am I happy that we now have had about 20% to 25% or sometimes higher than that ICU beds available in our region and regular hospital beds available? Yes. Am I happy that we have a contact tracing team of 125, which started out at 4 months ago, that allows us to quickly identify and complete 90% of cases within the very short time to know if there's something that's going on in the community that we're not aware of? I'm happy about all of that and feel that we have the capacity as a city to tolerate going to phase 3. Now, as the mayor pointed out, we have, let me elaborate on contact tracing. We've learned through this month of being a phase 2 that spread is happening when people are not social distancing and wearing masks. Okay, it's not happening because people are going to gyms, and it's not happening because they're going to restaurants. It's not happening because people are taking a walk in the park or going getting a haircut. It's happening when there's a bunch of people together. Often they know each other. Often they feel more at comfort and ease with each other, and so they don't practice social distancing that perhaps I may do if I go to the grocery store and somebody's walking by me. And that is when infection happens. So we're watching those things. It's those trends. It is that those are the types of things that we are that's making us have the comfort to move forward right now and move forward in a way that's amended that hopefully will reflect those trends. Now, I hope we don't have to slow down again, right? But this is where I'm asking the people of Nashville to do the things that show that work. Wear a mask, social distance, wash your hands. And if we do that, then hopefully we can get our economy and our society back to an area that we can all be comfortable with for gosh knows how long we need to until we get a vaccine. So thank you.
Those are all the questions we have today. Thank you to Dr. Hildreth. Oh, sorry, yeah, Dr. Hildreth, please.
I just want to emphasize one of the points that Dr. Jahangir made, which is the mayor has decided, and I'm really happy he has decided to be guided by metrics that are well established. They're on the website. You can see them. There are 6 of them. And that's why the decision is being made. That's being made because those metrics are favorable. And they are in Nashville because you have responded to the call to do what is needed to keep us safe. wearing the face covering, social distancing, all those things. So I'm pleading with us to keep those things going, because we don't want to be like some of the other cities that you are hearing about where things have gotten out of control. So, and again, to emphasize, the one thing that we can all do that will make a huge difference to keep those metrics where they need to be is to wear one of these when we're outside and interacting with other people. So we got this. Let's keep it going. Thanks.
Thank you, as always, Dr. Hildreth and Mr. Bedney for joining us this morning. The next scheduled Metro COVID-19 press briefing will air on Monday, June 22nd at 9:30 a.m. Daily updates are posted at covid19.nashville.gov. Thank you for joining us. This concludes today's briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.